Greetings from Health Angel Solutions once again, everyone. We're going to get really technical here because I think it's very important and we'll talk about it. Before we get started, please do me a favor if you're enjoying this kind of content. And if this is helpful to you, please subscribe and click the notification bell below because it would be really helpful to me. Today, we're going to talk about thyroid hair loss, and I'm going to share with you about 7 tips, or maybe a little bit more than that, however. I believe these 7 suggestions will be helpful to you. Now let's get going. I most likely have what I would consider to be the 7 most typical reasons why thyroid people have hair loss. Not necessarily causes, but circumstances that many patients may not be aware of might result in hair loss. This is particular to individuals with thyroid issues, but it can have any cause. Thus, it also applies to those with Hashimoto's. I simply want to start by saying that this applies to you if you don't have a thyroid, if you have hypothyroidism, or if radioactive iodine has destroyed your thyroid. Here are the 3 ways that your medication may be causing your hair loss. So let's start with the most important one first. I would rank this as the most important thing that many of you will have to deal with, your thyroid medication. I know you won't like this because it's a little complicated, but bear with me while we talk about it. Unless you figure out these 3 ways, it will be difficult to address the other ones. Thus, the drug itself is the first factor that may cause hair loss as a result of your treatment, okay? Again, this is the reason I said you wouldn't like this, but all thyroid medications, which I'm including all of them here, can cause hair loss regardless of what else they're doing to your body. This means that hair loss is simply a side effect of the medication. I know what you're thinking though, which makes it a little harder to figure out what's going on. But it really isn't that hard, okay? And here's why. Because the likelihood of one causing your hair loss is very small. They don't all cause hair loss. Well, they can all cause hair loss, which is confusing, but even medications in the same class might not cause hair loss for you. Let me quickly explain. For example, let's say you're on levothyroxine and you're experiencing hair loss. Your dose has been optimized and you believe everything else is going well, but you're still experiencing hair loss. In that case, you should switch to Thyroid. We see that you are switching between different medications within the same class, so you are switching from T4 to T4. This also applies to NDT medications, such as natural desiccated thyroid, naphthyroid, and nature. If your medication is optimized and you are still experiencing hair loss, it might be time to switch from armored thyroid to nature through ID or 2-naphthyroid, or whatever you can switch between within the same class. Many of you will benefit from this, so keep in mind that the medication itself can cause hair loss. The second way, and this is another big deal, is low dose okay. So this is what I'm trying to say here, is that you are on the right medication, but your dose is insufficient. So really what you are is hypothyroid still, and this happens all the time. Mind you, this is probably in a small percentage of you overall. And by the way, when I say this to some people, they freak out and say, well, what's the point? There's no treatment. I can't do anything. No, that's not true. It does make it hard, but just switching between medications should solve the problem. But this is a very high percentage of you overall. So many of you listening to this right now are simply not optimized, regardless of the medication you're taking. You cannot blame the medication. You cannot blame the Thyroid, the levothyroxine, the armor, or anything else, until your dose has been optimized and reached the proper level. So taking a low dose puts you at risk of hypothyroidism, which has hair loss as one of its symptoms. Therefore, you cannot attribute your hair loss to your medication until you're taking the recommended dosage. The third possibility is that your dose is excessively high. Now, this may only apply to a small portion of you, but you still need to be aware of it. If your dose is excessively high while taking your thyroid medication on Medicare, you run the risk of developing hyperthyroidism, which can cause hair loss as one of its symptoms. I realize it sounds a little confusing, but hair loss is one of the signs of both hypothyroidism and hyperthyroidism. In addition, hair loss is a side effect of all drugs. However, if you are aware of each of these factors, you can begin to make sense of it all. For example, when I assist patients in determining the cause of their hair loss, particularly those with thyroid issues, I would say that probably 60% of the time, the problem is up here somewhere. This means that either the patient is taking the incorrect medication, or the dosage is too high, low, or neither, unless they are self-medicating. Some patients, however, will self-medicate on NDT, and I believe they tend to go a little bit too high, and some doctors also engage in this behavior. So what does this really mean for hair loss? Let's find out, but first, if you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. We talked about thyroid medication, and now we're moving on to number 2, iron/ferritin. Now that we've covered thyroid medication, let's take a quick look at these two things. Iron is obviously something you know about, but if you're on 4 or 5 grains, that's probably a little too much for your body. That being said, there are people who need that, but that's a pretty high dose. Ferritin is a protein that measures the amount of iron in your body. It is significant because it promotes hair growth in 2 different ways. This is a problem for a lot of people, especially those with thyroid problems, as many women have low ferritin due to their menstrual cycle. Remember, if you're losing iron through blood bleeding of any kind, your iron will go down, and that will reflect in your ferritin. The first method is independent of your thyroid. It works on its own. Your body needs ferritin. It needs this nutrient for hair growth. Your hair follicles use it, and that allows your hair to grow. If your ferritin is too low, again, independently of anything else, your hair will not grow. Ferritin levels will decrease because prenatals typically have iron in them. This is the reason why many women who use multivitamins that contain iron do so. They will say things like, "Oh my gosh, my hair is growing like crazy. It must be this multivitamin. It's the iron in you, not this pregnancy that's pregnant." You would say that because it had little iron content and you were probably unaware of it. Ferritin is really important. The way your thyroid interacts with iron and inhibits iron absorption is the reason why, statistically speaking, probably 50% of thyroid patients have low ferritin or low iron. Having been in a hypothyroid state, particularly if you have a low dose, as many of you do, means that your body will eliminate a lot of the iron instead of reabsorbing it, which will drop your ferrit levels and cause hair loss. You may also have ferrit levels because low ferritin levels are caused by low doses, which also leads to low iron levels. Additionally, ferritin is necessary for the proper functioning of your thyroid, so you need both ferritin and iron in order for your body to run smoothly. The goal level is as follows. The range for iron is typically somewhere between 10 and 150, which is a wide range, and many of you listening to this will be less than 30. Okay, you're going to fit in here somewhere in this less than 30 range, so technically you might be normal. I've mentioned these tests previously, and I have another video which talks about all of the lab tests that thyroid patients should be getting because not only does it impact your hair, which is important aesthetically to many of you, but it also impacts your thyroid function, very, very important. Nevertheless, I have encountered several individuals who do not fall into the 10 to 11 category. As a result, many of you live in the lowest possible ranges. Several studies have shown that, in order for hair to regrow, you need a ferritin level of at least 30, but preferably 50 to 70 nanograms per milliliter. Check your labs for the exact range. This is the ideal range to aim for. Don't just look at the reference range, which is 10 to it occasionally falls below 50, meaning it could be 9 to 149 or something. However, you want it to be within this range. It's important to check out number 3. We've already looked at numbers 1 and 2, and number 3 is related to using certain supplements excessively. The 2 that I'm highlighting here are selenium and biovin. While low levels of these nutrients can cause hair loss, most of you already know that they can also be used to grow hair back. What I see more often than not is that high and low levels of these nutrients can cause hair loss. I'll explain what I mean. Let's say you're listening to this and you've read somewhere that biotin and selenium are important for hair growth. You decide to give it a try, and you may have read that you should take a relatively high dose and have been taking it for 6 months or longer, or even 3 months might be enough. But the point is, using these specific nutrients at high levels can actually contribute to hair loss. So, even though you may be taking them because your hair is falling out, thus you must exercise extreme caution. This is kind of a subtle point that a lot of people overlook, so I've included it here. You may be thinking, well, I've adjusted my medication, my iron is good, but I'm still taking 400 micrograms of selenium every day. That might be too much, and that could be part of the reason your hair isn't growing back. Keep in mind that this is why I usually recommend moderate doses of both selenium and biotin, especially for those who have thyroid patients. The fourth would be low zinc and B12. These are a little bit different though, so I talked about the nutrients. So, number 2, number 3, and number 4 are all related to nutrients, correct? We're talking about iron, ferritin, selenium, biotin, and zinc and B12. And I would say that most people tend to be low on these. Therefore, you don't really need to worry about that. But if you've been taking zinc or B12 for a long time, you're probably not experiencing hair loss. However, if this is your first time listening to this and you're thinking, I don't know if my B12 or zinc is optimized, or I don't know if I'm using the wrong kind of beets, check out my other video for more information on the symptoms of a B12 deficiency. Alternatively, you might be thinking, I don't know if my B12 or zinc is optimized, in which case it's probably worth taking either of these supplements, even at higher doses, as many people who watch this will likely be deficient, especially thyroid patients. Therefore, low zinc, low B12 number 5. We're on to testosterone androgens. I want you to focus on androgens that are too high. Usually, you can find this on your lab tests by checking a free testosterone or a DEA. These things, if they're too high in a woman, will cause something called male pattern baldness, okay? That's where your hairline starts to recede. You might grow thicker, darker hair on your facial hair and in other places on your body, which you shouldn't have as a female. A lot of women listening to this, especially those with thyroid issues, will have disrupted testosterone or androgens in some way. Thus, you need to be aware of your testosterone and androgen levels. If you check these and they are high, you can take supplements. Zinc, for example, is one of them. That can help lower your androgen levels and help eliminate the possibility that your thyroid is influencing your hair loss. Additionally, it's crucial to remember that your thyroid affects your testosterone. So testosterone in general is important if you have hair loss for any reason, but especially if you have thyroid problems. You'll find that your thyroid usually affects your testosterone levels, which is why this is so crucial. Now, number 6 was number 5, and we're on number 6, the E2/, which stands for estradiol or estrogen-progesterone balance. Yeah, you can still see that good, so this is referring to your estrogen and your progesterone ratio. However, if you fall into that PCOS-like spectrum, then those levels of androgen and testosterone may be too high, so pay attention to those again. I talked about checking ferritin and testosterone. Those are part of my standard additional lab tests that all thyroid patients should get. I have a video on it. Consequently, this is due to the same mechanism by which your thyroid affects testosterone, which results in hair loss. By the way, your thyroid affects the balance between estrogen and progesterone, which can also lead to hair loss. This is also the reason why women typically experience hair loss when they enter menopause. It's due to the drop in estrogen. But estrogen is equal in that both high and low levels can cause women to lose hair. So you should be monitoring your estrogen to progesterone ratio. If you find that it's low, many of you will also find that your progesterone is extremely low, and most likely there is a high level of estrogen, which is referred to as estrogen dominance. In that situation, you'll likely need to take steps to try to raise the progesterone levels once more. That's a topic for a later video. but make sure your progesterone to estrogen ratio is balanced. The final one is autoimmune. I know many of you probably already know this, but for those of you who don't, just know that 80 to 90% of people with thyroid conditions have this autoimmune disease. All right, so as I mentioned earlier, many patients with hypothyroidism also have thyroid issues, which are caused by this autoimmune disease. What I want you to know is that having one autoimmune disease increases your risk of developing another. One autoimmune disease that causes or contributes to hair loss is called alopecia, and it is an autoimmune disease in which your body attacks your hair follicles, causing your hair to fall out. Now, you'll notice that many people who have Hashimoto's disease also have alopecia, so it doesn't matter what else is going on up here. If your hair loss is caused by this autoimmune condition called alopecia, your immune system is the issue. I can include number 8 here, which is genetic. I don't like to talk about genetics because there are so many other things that I consider when trying to help someone with thyroid hair loss. But you have to remember that treating your immune system includes optimizing your vitamin D levels, taking supplements like zinc that may also be helpful, cutting back on inflammatory foods, and so on. All of these things will help reduce immune function, which can then help you treat your alopecia, which will then help you with your hair loss. Yes, it may come down to genetics, and there won't be much we can do about it. But there are a lot of other options that you can consider. If you're having problems with hair loss, please tell me about them in the comments section below. It will help me know how many people I'm speaking to and what issues they are facing. If you've been able to address your hair loss, please share your solution with me as well. You'll notice that this is kind of a methodical approach. However, it won't be the best course of action for everyone. And as I previously mentioned, I haven't even included everything because there are just so many aspects to consider. Thank you for watching our video on how to stop thyroid hair loss. We hope these tips and insights have been helpful in understanding the connection between thyroid health and hair loss, and how you can take control of your hair health. Managing thyroid-related hair loss can be challenging, but with the right approach and consistent care, you can see positive changes. Remember, it's important to work closely with your healthcare provider to monitor your thyroid levels and ensure you're getting the appropriate treatment. In addition to medical management, adopting a balanced diet, using gentle hair care products, and incorporating stress relief techniques can make a significant difference. At Health Angel Solutions, our mission is to empower you with knowledge and practical solutions for a healthier life. We are dedicated to providing you with valuable content to help you navigate your health journey. If you found this video useful, please give it a thumbs up and share it with friends or family members who might benefit from this information. We'd love to hear your thoughts and experiences in the comments below, so feel free to share your story or ask any questions you might have. Don't forget to subscribe to Health Angel Solutions for more videos on health and wellness, and hit the notification bell so you never miss an update. Together, we can build a supportive community focused on achieving optimal health and well-being. Thanks again for tuning in, and we look forward to seeing you in our next video. Take care and stay healthy.